Hi, my name is Patrick and today we'll be going over various flexibility fitness assessments. Prior to beginning our fitness assessments for flexibility, we'll engage in a 5 to 10 minute aerobic warm-up. Our first assessment is called the Canadian Trunk Forward Flexion Test. It assesses hamstring and lower back flexibility. Protocol calls for the removal of shoes while having the feet flat against the box in a sitting position. It's important to exhale while reaching forward and not leading with one hand over the other. Ensure that the knees are not bent while reaching and the position is held for 2 seconds while it is measured. The Canadian Trunk Forward is scored in centimeters. It is important to repeat the assessment twice and take the best of 2 scores. 30 centimeters was my score, placing me in the category of good for males aged 20 to 29. This is assuming that the 0 point of the box is set to 23 centimeters. If it is set to 26 centimeters, add 3 centimeters to the value and reassess for fitness category. Next up is the YMCA sit and reach test. Protocol calls for a piece of tape laid across the floor with a yardstick placed in the middle of the point where the 15-inch mark crosses the tape. In a seated position, legs are to be extended with feet 10 to 12 inches apart and heel placed at the tape's edge. It's important that the knees do not bend while exhaling and reaching forward. Once again, one hand may not lead over the other, and fingers are to touch the yardstick for the score. YMCA sit and reach assessment is scored in inches. Taking the best of 2 assessments, scoring 19 inches placed me at the 70th percentile above average for males ages 18 to 25. The chair sit and reach test can be considered the ideal flexibility assessment for older populations. This assessment calls for a chair 17 inches in height to be placed against the wall so that it does not fall from underneath the client. There is no need to remove the shoes. Client is just to sit on the chair, extend one leg, keeping the ankle dorsiflexed, while the untested leg is to be bent, keeping the foot nice and flat on the floor. The head is to be kept aligned with the trunk while reaching forward. A second individual will hold a ruler and assess. Exhaling while reaching forward, it is important that one hand does not surpass the other, and that the reach is held for 2 seconds. A negative score will be the measurement falling between the big toe and fingertips. A positive score will be the space where the fingers pass the big toe. Merely touching the toes is scored as a 0. The chair sit and reach test calls for measuring the right flexibility and left side flexibility. Next up is the Thomas test, which tests for hip flexor flexibility. It calls for the client to lay supine, as so, and bringing one leg to the chest. If straight leg remains in contact with the mat, the hip flexors are categorized as flexible. If the leg starts to bend away from the floor or mat, then the score is inflexible. Assessments are to be performed on both sides, and a second person may be used to assist.